Welcome, I'm Dr. Janine Bowring, naturopathic doctor, and today I'm talking about inflammatory bowel disease with 9 tips for IBD. So make sure you stay tuned right until the 9th tip, which is something you've probably not heard before about dealing with IBD on the mind-body level. Tip number 1 is to make sure that you are fixing your environment. So I can't stress enough the fact that toxic blue light from all the artificial lights, whether it's from our devices and any type of artificial light that's plugged into the wall, is something that is definitely having a negative impact on your health and your circadian rhythms. And in terms of the signaling as to what's going on with your overall energy and your mitochondrial health, it's really important that you are getting more natural light exposure, but also decreasing that toxic blue light. Also, you have to decrease your exposure to non-native EMFs. So whether that's from your cell phone, from your tablets, from your television screens, basically anything that, again, is plugged into the wall is potentially setting off that radiation into your environment and really has a negative impact on your gut microbiome as well as your cellular function and your circadian rhythm. So it's really important to decrease your EMF exposure. Check out my other YouTube videos on how to do this naturally. Tip number 2 is to fix your leaky gut syndrome. So if you missed my episode on leaky gut, make sure you check it out, The Science of Leaky Gut, everything you need to know about leaky gut. And what I explain there is that our brush border in the small intestine needs to be healthy in the fact that the tight junctions are nice and tight together. What happens in leaky gut is that those tight junctions can open up, and then now that allows for the passage of not only undigested food to go through, and this can cause autoimmunity and problems with inflammation in the body, but also those unhealthy gut bugs. So these could be parasites, candida, the bad bacteria passing through, and now our immune system and the rest of our body is having to deal with that toxicity. So this is something that we definitely want to provide the right nutrients to be able to ensure that our tight junctions are nice and close together, and that's why fixing that leaky gut syndrome is really important. So hop on over to that video when you're done these tips today to make sure that you're doing everything right for fixing the leaky gut. Tip number 3 is to do the Castor Oil Pack. So this is not only really relaxing and soothing, but really does help with that overall inflammation in the gut. So what you're going to want to do is cover the entire abdomen, including the liver on the right-hand side, to really help to activate the GALT, which is the gut-associated lymphoid tissue. It's part of your immune system, which is specific to what's going on in your digestive tract. And again, helping with that lymphatic flow, making sure that it is nice and anti-inflammatory, because that heat that you'll apply with a hot water bottle is remarkable at decreasing that stress in the nervous system as well. So check out my entire video on how to make the Castor Oil Pack. Ideally, you're going to do this for about 45 minutes at least 3 times a week, and you will really love the benefits of that for your inflammatory bowel disease. Tip number 4 is to follow Mother Nature's prescription. So you've heard me talk about this in other videos. I want you to get outside and enjoy the fresh air. I want you to exercise. Making sure that you are outside enjoying that sunlight and getting that natural sun exposure is very important as well. So getting that early morning sunlight in your eyes not only activates your brain and all your hormones, but it really does have that positive influence on that inflammation in your body. Also being grounded, so making sure that you do that with bare feet on the earth and doing that every single day. Get grounded as much as possible. Kick off those shoes and do everything you can to get grounded on the earth. Also making sure that you're drinking a high quality water. So whether that's reverse osmosis or it could be volcanic spring water, finding that right water that you are consistently drinking and hydrating is very important no matter what type of inflammation you have happening in the gut. So this is especially important for anybody who has chronic diarrhea issues, and you have to be mindful of maybe some of those negative organisms and those parasites and things that could be in the water as well, and also making sure that it's fluoride-free water, and that's why I like reverse osmosis as a type of water to drink, and getting enough minerals is always important as well. So I will have future videos on the types of water to drink and my preferred types, so make sure you stay tuned for that. Also getting enough fresh air in general. So if you you do live in the city, seeking out that fresh air from the forest, you know, getting out of the city on the weekends especially and away from those city pollution is something really fantastic that you can do not only for your lungs and breathing in more of that oxygen and that clean air, but for that connection with nature and that mind-body connection with the earth as well. Tip number 5 is to watch the foods in the diet. So there definitely are some more inflammatory foods that you definitely want to decrease. So that could be the inflammatory fats that I've talked a lot about, like the polyunsaturated fatty acids. So that's the canola oil, the vegetable oils, the margarine, all of those, you know, not so healthy inflammatory omega-6 fats are just that, very inflammatory to the gut. So you've got to get those out of your diet immediately if you've got them in the house. So often they're going to look something like this, you know, canola, vegetable oil, just get it out. Just do it today. Just toss it out, get rid of it. I know it costs you money, but just get rid of it. You want to get the healthier, less inflammatory fats, which is something that I'm going to share in just a moment. Also, you want to decrease your lectins. So lectins are found in undercooked beans and legumes, as well as tomato skins. And this may just be at the beginning. I mean, certainly if you're eating legumes and grains, you want to cook them properly, but in other sources of lectins, you know, it may just be at the beginning that you really have to decrease your exposure. Also making sure that you are getting rid of the sugar in your diet. And I can't stress this enough. I have an entire show all about sugar addiction and why it's so inflammatory, especially refined sugar and all those treats and sweets that you love. You've got to do your best to just simply get them out of the diet, especially for inflammatory gut diseases as well. You want to get the sugar out, and you will thank me because when you're feeling better, you won't even want them anymore. And that's the great thing about getting over that sugar addiction. So make sure you check out that video. Also following the low FODMAP diet. So this is something that a lot of practitioners will recommend to their patients if they are suffering with IBD, and that means decreasing specific sugars. So the oligosaccharides, which can be in the grains, so in wheat and rye and some of the legumes, and some fruits and vegetables have the oligosaccharides. And disaccharides, which are commonly found in dairy products like milk and yogurt and some of the soft cheeses, because lactose is that main carbohydrate that is problematic for a lot of people who are suffering with the inflammation in the gut. Also, some of the monosaccharides can be problematic, so including figs, mangoes, and some of the sweeteners like honey and agave, which is very high in fructose and can be very irritating and feeding some of those bad bacteria in the gut, and that's why those are limited in the low FODMAP diet. As well as the polyols. So these are in some fruits and vegetables, but commonly found in the artificial sweeteners. So this is something that is definitely very irritating, even for people who don't have inflammatory bowel disease, that you may notice that you're a bit gassy after having some of these polyols in the artificial sweeteners. So you definitely want to limit those in terms of your diet. Tip number 6 is other dietary changes. So definitely increasing more of the probiotic foods. So whether this is sauerkraut, this is a fantastic thing you can do. You can make it yourself. I actually have an entire video on how to make sauerkraut yourself, and it's super easy. It's cabbage and it's salt and your hands, and that's it. So make sure you check out that video, how to make it yourself. Also increasing fibers like chitin. So chitin from the outer shell of crustaceans, so from shrimp, and you know, shrimp is probably the easiest one to get down, but this is something that will help to diversify the gut microbiome, and it is that source of fiber that in studies has been shown to be really helpful for IBD. So that's something that is very promising. So don't throw it away. I used to always throw away the little tails of the shrimps. Crunch them down. You've got to chew them very well, but you know, it's not just for the dog like I used to give to my dog. It's not just for the dog, it's for you as well, and helps with that gut diversity of those microflora in your gut. So some people may also take a fiber supplement, which can be very helpful. So one one of my favorites is a psyllium seed husk supplement. We'll share that link below so you can look up, a gentle fiber supplement to really help with the IBD. Also increasing your healthy fat, so making sure that yes, we're getting those inflammatory PUFAs out of the diet, those omega-6s, but increasing things like DHA. So DHA, whether it's found in fish or seafood or a good high quality, molecular distilled supplement of DHA, that's really important. So we'll share that link below as well. But DHA is important because it converts that light that our gut microbiome is actually giving off into an electric current. And this is that electric current, and that magnetic message of that DC current helps with the GALT, so the gut-associated lymphoid tissue, which is that immune part of our immune system in the gut itself, to send those proper signals to our entire immune system and what's going on in the state of affairs as to what's happening in our gut. So this is really important to protect our body from the invasion of some of those bad organisms that I've talked about, like the parasites and those bad bacteria. This is the crux of what's happening in the gut. So that combination, again, getting back into the sunlight, getting that proper sunlight exposure in our eyes and on our gut. So actually exposing our gut to that sun is really important. So yes, bikinis and, making sure that our gut is exposed to the sun is very helpful for your IBD. And I'm not sure if you've heard that before. If you have or you have not, I would love to hear about it in the comments. Also making sure that, especially if your stools are very loose, that you are including some other things to help maybe with mitigating that risk of some of those bad bugs. So pumpkin seeds are fantastic for parasites and slowing them down, making sure that you are chewing them very well. If you really have a lot of inflammation, then I do recommend putting this in the blender or getting a pumpkin seed butter so that it's already broken down and nice, and smooth consistency for you. Also eating more bitter greens. So those bad bugs, they don't like bitter foods, so eating those bitter greens is fantastic as well. Okay, tip number 7 is to use some specific herbal medicines. So when we talk about, irritable bowel syndrome, whether it's IBS-C, what I usually do recommend is doing a full body detox with some of my favorite herbal medicines at least a few times a year to stay a step ahead of that toxicity. And this is something that you can definitely look up on my videos all about full body detox, how to do that. And also systematically taking something to kill off those bad organisms and those parasites. So this is something also that you can check out in my parasite videos, which are always interesting. And yeah, don't be squeamish. It's always a lot of good information, but more importantly, what you can do naturally to take care of some of those bad organisms. In terms of diarrhea, if you've got chronic diarrhea and dysbiosis happening, then it's important to take specific herbal medicines for this as well to help to regulate what's going on with that gut flora. So we'll share some links below to some, great products that you can take to do this naturally. Okay, tip number 8 is the Ileocecal valve massage. And this is something that I've shared in another video, especially if you have constipation. So it's something that, you definitely want to make sure that there's no mechanical issue with that valve. And that happens where the small intestine meets the large intestine. And this is where the poop, if I can say that, is moving through, the chyme is moving through into that section of the first part of the large intestine to be evacuated eventually. So when that valve has an issue and it's stuck and it's not emptying as well as it should, this is when you can run into more problems, especially with the constipation. So make sure you check out that video. It's a great technique. I know a lot of you that have been watching my videos and following me are using this now for your constipation, and it's working wonders. You've shared that with me, so that is great news. Okay, tip number 9 is the mind-body connection. This is the one you were waiting for. So, you know that in most videos I like to, make that connection. You can do everything right in the physical realm of dealing with the inflammation and dealing with the dietary changes. But if you still have that mental, emotional, or that energetic, spiritual aspect as to why you have that inflammation in the gut, you won't get better. And this is why it's so important that I really want you to pay attention to what is it that you're swallowing that's bothering you. So there's something maybe in relationships, in what's happening in your job, in your life with your family, with your spouse. What is going on? What do you keep swallowing that you shouldn't be? What do you keep swallowing and you're not dealing with that is making your gut inflamed? So if you can answer that question, you can figure it out. And you use some tools, some meditations, reaching out to someone to have a conversation about this, letting it go. If it's not serving you, just let it go. Just get rid of it. You don't need it anymore. And I really hope that this impacts you in a positive way so that you can resolve and get over whatever is ailing you in terms of your inflammatory bowel disease. So I hope you learned something new. Please do leave your questions and your comments below. I truly appreciate it. Be sure to share this video with someone that you know needs to hear this information as well. That's really, really important. And give me a big thumbs up. I truly appreciate all of your great feedback. Also, if you're new here, welcome into my channel. Please make sure that you're subscribed and you click that bell so that you get notified of all of my newest and latest uploads, which happens every single day of the week. And remember to always take good care of your health and do it naturally. Thanks for watching today.